trying to find it. Here it is. I can't hardly hear anything. That's it.
Do you know how far back it was?
Well, we're going to talk about it anyways. And welcome back to Medicaid Matters. This is the only live and interactive show about the business of Medicaid healthcare. You know, MedicaidJobs.net is becoming the place where the Medicaid community goes to post their jobs, to research new opportunities, and to accelerate the next step in their career. Our firm, Managed Medicaid Services, is currently working on hundreds of jobs for Medicaid and Medicare organizations. Many of them can be found at MedicaidJobs.net. If you don't see what you're looking for, then give us a call at 866-371-0687, extension 210. Well, we're going to continue our conversations here with the award-winning recipients at the second annual Medicaid Health Plans of America Centers for Best Practices second annual awards forum. And with me right now is Don Graff and Rita Johnson-Mills of UnitedHealthcare. How are you doing?
We are wonderful.
Well, you might need to move just a little closer to the microphone if you can. I know we're kind of cramped in here. But you are one of, well, you're actually co-recipients of the Technology Award this morning. Do you happen to bring it with you by any chance?
Yeah, I forgot it on the table.
All right, well, we'll get it.
Yeah.
We don't want you to have to leave to go do that. Now, tell us a little bit about the program that you won this award for.
I'll ask Don, since he's one of the primary developers of it, to take that question.
Well, essentially, we're using telemedicine technology and coordinating the delivery of services to complex pediatric children living on the Navajo Nation. Most of these children are neurological in the diagnosis that they have, and often have to travel several hundred miles each way in order to see a physician. This helps them and their families being able to receive services in their community without having to travel those long distances.
I can imagine. How many people are involved, or how many children were involved in the program?
Right now, today, across the state of Arizona, there's 24,000 enrolled members covered by UnitedHealthcare that meet these complex diagnoses. On the Navajo Nation, the numbers are quite a bit smaller, but they are extremely remote people, and why we targeted that smaller population to receive these benefits. Hopefully, with the success of this program, we'll be able to reach out to other communities and expand the services using this technology.
Well, I can certainly attest to how difficult that group is to reach. Our firm a couple of years ago put together an assessment team for a Medicaid health plan in New Mexico, and the Navajo Nation there was part of that. And the only requirements we had was a nurse who could speak Navajo and have a four-wheel drive pickup truck. And I remember seeing some of the directions on how to reach some of the members were, there were no streets names or anything like that. It was mostly landmark driven. So it's a very difficult group to reach.
Yes, and we're actually using this project across UnitedHealthcare Community and State. We're currently located in 23 states plus the District of Columbia, and we're the largest Medicaid health plan in the country, serving over 3.6 million lives. So our goal is to learn about the cultural needs and differences of different populations, and we're learning a lot from the Navajo Nation's project so that we can continue to expand these programs in other states that we're in, where we're primarily dealing with rural populations that are not used to accessing the U.S. healthcare system. So very exciting.
Yeah, it is. And this is something I was going to ask you about is this a model that can be exported to other locations. It sounds like it is.
It is, and Don can speak to how it's being used even across the state of Arizona. We also have a health plan in New Mexico, so we're watching this very closely to see what pieces of it can be adapted across that state as well.
I could imagine, yeah. Tell us a little bit about the actual mechanics of the program. How does it, how does a child get engaged in the program, and what does it do with them?
Well, first, the child has to have the diagnosis that allows them that level of complexity.
What would be an example of that type?
Spina bifida is an example. Cleft lip and palate is another example. Different neurological and cardiovascular anomalies are typical birth-related and ones that are complex enough to allow them admission into the program.
So we're not talking about just chronic things?
No.
Okay, all right.
Many of these require initial surgical interventions and then a lot of monitoring and so to a certain degree therapies over the course of the child's life. And in many cases, the every 6-month follow-up with a physician and or yearly follow-up with a physician until the child gets older is also part of the medical management of that child throughout their life.
Yeah, I could imagine. So they engage, I know this is a technology-oriented best practice, so how do they engage with the technology? Because to me, with someone being so rural and so forth, you think, well, do they even have cable?
Well, it's very challenging, as a matter of fact, and you almost have to go community by community. We targeted Tuba City. It's a community in the western side of the Navajo Nation. They fortunately have some T1 lines that go in to that location. We're engaging in discussions with other more remote communities, and to the extent that they either have cloud-based or internet-based connections, or some cases broadband. And unfortunately, in many cases, none of the above, in which case it makes the connections a little bit more difficult.
Do you see yourself bringing the technology into their area so that they can make those connections?
We're supportive of virtually every different aspect of reaching out to the communities, including the use of the cloud-based technologies, which seem to be the ones getting the most traction these days because they involve a lot less cost and capital infrastructure to make those to make that happen.
Yeah.
You're not having to lay lines and things like that.
And just to add to that, through the services side of United Health Group, Optum Health, we do have access to telemedicine vans where we take them into rural areas and actually have members and others actually connecting with physicians right through that telemedicine van. I remember my first experience with telemedicine where I was dealing with an ophthalmologist, and it was just so exciting to sit there and he's using a machine and he's in another state looking into my eyes.
Yeah, isn't that something?
That was just fascinating.
Yeah, we always thought that we'd be living like the Jetsons when that stuff happened, didn't we? But it's here. I mean, it's here, and it's real, and it's making a difference in the lives of people.
Yeah.
What have been some of the outcomes that you have seen from this program?
Well, we've conduct surveys with families and physicians for every one of the encounters that we do across the state, not just on the Navajo Nation, and we get a overwhelmingly high response, positive response of satisfaction from the families. The costs associated with and savings associated with these encounters are pretty self-evident when one considers lost wages, the mileage, and of course with the price of gas as it is, hundreds of thousands of dollars a year in savings for families, and in some cases even physicians who oftentimes will commute and travel out to those communities. They could be in their offices otherwise seeing patients during the time that they'd be spending on the roads. So high satisfaction, the cost is lowering. This is going to be a healthcare delivery model that we'll be seeing a lot more of in the future.
And And just to add, I think two other things that we're seeing is it's just the building of the relationships and really becoming much more closer to populations that have primarily been closed to allowing healthcare companies in. And so we've been able to demonstrate a level of compassion that has caused them to open their doors and their homes to allow us to come in, because they truly can see that we value them and that we really want to be a part of making the healthcare system work for them.
Did you see any initial resistance to people to get involved with this when you first rolled it out?
The relationship, and I want to echo what Rita was saying, the developing good relationships with folks on the Navajo Nation really involved primarily trust, and a long and sort of nurturing process by which, through that trust, we're able to extend and collaborate services to the people in their community. Not a small feat, and something that it requires a constant high touch and sensitivity, not only to the culture and the competency and how to respond to different cultural differences that and values that the Navajos believe and feel very strongly, and are things that we have to be very, very acutely aware of.
I would imagine. Yeah, and that brings up an interesting point. If if this is something you feel like you can export to other communities, how would this program have to change? Or I guess a better question is, how much is this program customized to the Navajo culture and community that it serves, and what would have to be changed to export it to, say, to another culture?
Well, from a technology standpoint, probably not a lot, but in the medical and clinical protocols that we have for how we engage with families and the patients will need to be adapted to the particular communities that we're involved with. How we treat folks in the Navajo Nation is slightly different than we work with Hispanic communities or with any others communities where different social needs and competencies need to exist. We're very acutely aware of those and respond to them accordingly.
Okay.
Yeah, United really does not approach healthcare as a one-size-fits-all. We try to take advantage of scale in those things where we can, such as technology and innovation. But when it comes down to what's going to work with a particular member population or our ethnic group, we really, really customize to meet their needs, to understand their culture, to make sure that it works for them.
Right. And we're seeing that in a lot of our clients, where they're really reaching in and utilizing community-based resources to incorporate into the plan, as opposed to trying to create everything on their side of the house and just make it fit within the community. Let me ask you a little bit about the technology side of this, because I know some of our listeners that are in that field might be curious about that. Was this a program that you developed from scratch, or was there something going on that you took and adapted and molded into this program?
Well, first of all, we selected the Tuba City location because they had expressed an interest in leveraging technology to service their community. And with that sort of spark of interest, we're able to collaborate with some state funding, some Title V block grant funding that allowed us the opportunity to enhance some of the equipment that they had to more of the high def and things that some of the neurologists really required in meeting this population, and so that helped, coupling that with the video conferencing capabilities offered by different companies, coupled with the T1 line connections, in association with the Arizona Telemedicine program, which is kind of a network of T1 connections that we have in the state, all sort of brought together to as a package to fit the needs of the community.
Interesting. So what's the next step for the program?
Well, as we develop these relationships and offer this technology, we're already receiving inquiries from other locations on the Navajo Nation, and as you may be aware, the Navajo Nation crosses the state borders of New Mexico, Colorado, Utah. So without any state boundaries, getting inquiries from other communities on the nation to explore similar deliveries in their area.
Are they all communities served by United, or is it a mixture?
There are other health plans that serve the communities, but they're not serving them in the same way that we are. So we would focus primarily on those members that are served by United. So we have no boundaries where that is concerned.
That's well, if anybody knows about scale, it's United. There's no question. Well, it's in the compendium.
Yes.
And organizations that have an interest in this can certainly see the outline of it if they want to, and it sounds like it's just a really, really interesting program. It's these things, I think, that's going to take us to move Medicaid to the next level, is a lot of creativity, a lot of innovation, and certainly the use of technology put into play, particularly in areas where, in the past, these people just would not have gotten any care. Just because you couldn't connect with them.
Yeah, and that's what I think is so important about this best practice forum, and what Thomas Johnson has been able to do through Medicaid Health Plans of America is really making everyone aware of all of the great things that's happening across all Medicaid plans, and what we can do to help move the healthcare industry forward for those less fortunate. So it's really an exciting time to be in Medicaid.
It is, and I think people that are outside of the Medicaid community or the state policy community, they really are lost on what people like yourselves are doing to. And the name of the game is we've got to help these people get the care they need and to live better lives. And there are a lot of dedicated people, not just in this room, but across this country that are working on that.
Yeah, and as a former Medicaid recipient myself, I'm the product of the Medicaid program. I was born to a single female, one of 12 children. So I know what it's like to not have access to health care.
Yeah.
And to be in a position now to work for the largest health care company in the nation, making health care happen for those little people like me, it's pretty exciting.
It is, no question about it. Well, it's great work. Well, I really appreciate you taking some time to stop by and talk with us. I know our listeners are very excited to hear about these types of innovations and developments, and congratulations on winning the Technology Award.
Thank you. Thank you so much.
All right. Have a good day,
and
we'll see you around, I'm sure. Thanks.
Hopefully we'll be back.
That's right, for the next one, right? That's right. Well, that was Don Graff and Rita Johnson Mills from UnitedHealthcare, co-recipients of, or United is co-recipients of the Technology Award for the innovation in their telemedicine program. And that's what we're hearing here at this awards forum. We're hearing a lot about new innovations. We're hearing a lot about the best practices of Medicaid health plans and what they're doing in the community. And in just a moment, I think we're going to be joined by the other co-recipients, which is from Midwest Health Plans. Kathy Harkness will be here in just a few minutes to talk about the program that they won that award for, their best practices. We're trying to keep all this organized here because there's a lot going on today. So if we're moving through things rather quickly or trying to get our information together, just bear with us here, because I've never seen a greater collection of ideas and forward-thinking initiatives going on than is what is in this room today. So if you think that this is something you want to hear more about or be involved with, there's a couple of things that you could probably do. One, certainly go to